We had some positive news that we've seen a flattening of the curve, particularly in ICUs and hospital admissions for now weeks and weeks and weeks, well beyond the 14-day CDC guidelines. Both in the ICU space and the hospitalization space, we saw declines yesterday versus the previous day. We also saw it in those PUI numbers, again, people under investigation in those two categories as well. That's always a wonderful day when we see all four of those indicators turning green, or at least moving in the right direction. Today, we would put out guidelines to move into what we refer to as phase 2 of our reopening plan. And that's exactly what we will be doing here today. We have been working with counties, large and small, all across the state, including those that may have gotten ahead of themselves a little bit, try to pull them back in the spirit of collaboration and cooperation. The guidelines we're focused on today are extending opportunities in the retail sector, the manufacturing sector, and the logistics sector, all with adaptations, all with modifications. And also talk about what we're looking for in terms of getting deeper into this second phase and what that looks like from a dining in capacity, meaning opening restaurants, not just to takeout, but providing the ability to dine in. We'll talk about outdoor museums potentially opening up, car washes, and the prospect of them.
It does not mean a return to normal. We've talked about how retailers are going to be doing more curbside pickup, potentially delivery. We're encouraging those retailers to install hands-free devices, and maybe their delivery trucks are full with sanitation materials. But some counties can move safely further into stage 2 as they can attest to a number of the things that I will walk you through in a moment. Things like counties being able to attest that they've had less than one case per 10,000 people in the last 14 days, no COVID-related deaths, that they're able to protect our essential workers with protective gear, and that they're able to support those same workers when they're sick or exposed to COVID-19. That we have adequate testing capacity in those counties, that we're able to do that contact tracing with those disease detectives that the governor's been talking to us about, and that furthermore, we're able to support with temporary housing and have at least 35% capacity for surge. And in order to attest for the regional variants, a public health officer must be able to say that their skilled nursing facilities have more than 14 days supply of PPE. And we need to make sure that each county has the ability to understand their data and pull back from some of these modifications. We know that this is going to be a gradual move into stage 2.
That may sound significant, but it is as well very insignificant. And the biggest restriction, of course, is customer confidence. Just because you open doesn't mean a customer is going to show up, and nor does it mean your workers will show up. And that's why all of this is focused on not just the business opportunity, but the responsibility we have to one another that will allow us to make some real progress.